Hey, what's up everybody? Today is a video that I honestly never thought I'd have to make, at least not now. My father, a sculptor, was living in a nursing home on Long Island after his dementia diagnosis in 2016. My dad turned 89 on April 3rd. I talked to him last Saturday and he was completely fine, and by Wednesday night he was dead from COVID-19. I'm Risa Morimoto, your host, and you're watching Modern Aging, where we chat about innovative and holistic ways to optimize our health and well-being as we age. If you want to click on that little red button below that says subscribe on it, please do so, and click on that little bell next to it. If you've been following the channel, you know that my mother passed away 6 months ago after 19 years caring for her. She had a massive stroke in 2001 and then was diagnosed with Parkinson's in 2009. So death is something that I've actually talked about quite a bit recently on this channel. I find that it's a really important part of life, and we don't talk about it enough. When death arrives, and it will arrive, we're a mess with no direction of what to do. Even though I watched the news and saw that nursing homes were being affected at a higher rate, somehow, I don't know why, but I thought my father would be immune. He's a survivor, and he was super tough. He was as tough as they came. But he too became a statistic. We see these numbers growing every day, and honestly, I don't think they mean much to most people. But if it's your parent, your spouse, sibling, child, friend, you feel that one number, and that is overwhelming. You have to remember, it's not only millions of people that are dying, but it's also the even more millions now without their mother, father, brother, sister, child, friend. Normally, it would take me a while to share something like this publicly, but I feel like we're in the middle of this pandemic and millions of more families are going to experience what my family is experiencing. No one is immune. So I find it really important to share what happened so that you can be better prepared, ask the right questions, ask questions that I wish I had in the event you have a loved one in a nursing home, institution, or in a hospital. My father was put on lockdown on March 22nd, as were all of us who live in New York State. His dementia affected mainly his short-term memory, so I imagined it was probably hard for him to get his head around the nurses wearing their PPE all the time. On Saturday, April 18th, we talked to him on the phone, telling him that we wouldn't be able to go and visit him anytime soon. He said that he was fine and that we didn't have to worry about coming to see him. On the following Monday, I found out that his nursing home had COVID cases. I don't know why I was surprised, but I just was. My husband and cousin advised me about what to ask the nursing home. So I think that these are questions that you should ask if your parent or loved one lives in a senior living facility. Some of these questions you can ask in the event you or a loved one is hospitalized as well. 1. How many cases of COVID are there in the facility? 2. Have there been any deaths due to COVID? 3. Are the COVID patients quarantined away from the healthy patients? Or are they on a separate floor or at least a separate wing? 4. If not, what kind of procedures and protocols do you have in place to ensure the healthy patients stay healthy? 5. Are the medical staff, especially nurses, solely dedicated to taking care of patients, COVID patients, or are they caring for healthy patients as well? If they're caring for both sick and healthy patients, how are they ensuring that they're not spreading the virus? 6. Do you have adequate PPE for the staff? What happens if the patient needs to be hospitalized? And at what point do you contact the family? What happens when there is a death? What is the family expected to do? After I found on Monday that the nursing home had cases, I called Tuesday and was reassured that they were doing everything to keep COVID patients separate. But as I discovered, there were COVID cases on the same floor that my father lived, so I knew that he was in danger. Although I'm sure the nursing and medical staff were doing all that they could to keep the virus contained, it actually seems nearly impossible if it's on the same floor. On Wednesday afternoon, we received a call that he was unresponsive on the toilet. He was placed in his bed with oxygen and resting. I requested a video call with my dad, but they couldn't arrange it to the following day, so I said fine. He apparently ate a little bit of his dinner, but was very passive and quiet. He refused his evening medication, so the evening nurse told the overnight nurse to keep an eye out for him. When the overnight nurse went to check in on him at 12:30 at night, he was gone. They tried to reach us 3 kids. I have 2 other siblings, but we were all sleeping. Somehow my sister woke up at 2 a.m. hearing the phone ring. She then called me on my landline. As you can imagine, when your phone rings in the middle of the night, like your heart goes crazy. You're fearing the worst. And this time the worst was my reality. All I kept thinking was, what the hell just happened? He wasn't sick. He didn't have any of the typical symptoms, fever, dry cough, respiratory issues. Yeah, he was found unresponsive, but was placed on oxygen. But yet, 8 hours later, he's dead. We dug deeper and did some research to find out that some seniors actually have been having symptoms of confusion and extreme lethargy, and none of the other typical symptoms that we keep hearing about. So we need to know that this virus isn't just one thing. The only thing that brought me solace was the fact that he didn't suffer, or he didn't seem to suffer very long, and he didn't have to die in a hospital. If your loved one should die, the main problem right now is that families are not allowed to see their dead loved ones. We were not able to go to the nursing home. The one big thing I regret is not getting on a video call to at least see him right away after he passed. It's hard because you're not in the right state of mind, and for me it was like completely unexpected. It was in the middle of the night, so I wasn't thinking clearly. But if it's a death due to COVID-19, you got to know that you're not going to be able to see them. So it does help to bring some sort of acceptance. Not really closure, because that's not possible, but to do a video call, I think I would completely recommend. I called the nursing home right after I talked to my sister, and they told me that I need to call a funeral home to have his body removed. Basically, I would have to Google a funeral home and pick one. This is like crazy. The worst thing you could probably ask someone to do after their loved one has just died. I mean, all I kept thinking about is like, this is ridiculous. But then I thought of the funeral director we used for my mom 6 months prior. And so luckily, we developed a great relationship over the past few months. And I even interviewed her for an episode on Modern Aging about home funerals. Everything we did for my mom could not be further from what we were experiencing with my dad. I called Amy Cunningham from Fitting Tribute Funeral Services and couldn't believe it. She actually answered the phone at 2:30 a.m. and said she would take care of my dad and make sure he would be safe no matter what. Like, that was everything in that moment. You need to do your research on funeral directors and homes now. Ask your friends and family. Yeah, it might feel a little bit morbid, but having someone you don't know or trust suddenly be responsible for your parent or loved one, especially under this kind of stress, is truly almost unbearable. The reality is that even if you have a funeral home, right now with the enormous number of deaths, they may or may not be able to accept your case because they have no place to store them. There are just too many bodies. I was lucky enough to have a relationship with Amy, so that's why she was able to take care of us and my dad. Honestly, she is a godsend. Apparently, there are people who have died in their homes and they're still waiting for someone to pick them up 10 days later. It's like crazy to me. Amy was able to secure his cremation date for May 22nd. This is one long month for us. That's how backed up the crematoriums are. He was taken to some freezer truck, essentially where he will be until his cremation. Those of you who may not know the role of a funeral director, essentially that person will arrange for the pickup of the body. They normally arrange for the cleaning and embalming of the body as well. But you should know that embalming is super toxic and does not have to be done. I found that out when my mom passed. The funeral director helps with burial or cremation details. They'll coordinate with the family. She also arranges for the death certificate, where she coordinates with the medical examiner's office. It's important to have someone who has your best interest in mind and not just ripping you off while you're in your vulnerable state of mind. These people do exist, so you want to be wary. During this time of COVID, there are no proper funerals now. No viewings, no gathering, just direct to cremation. The fact that we can't see my dad's body made me realize that the viewing is just so important to us as human beings. It doesn't give us closure, but it does help us provide acceptance of the death. Because without it, you feel like you're floating or imagining if what's happening is real, wondering if maybe they made a mistake. But there is no mistake. My father is gone. So what can you do in lieu of having a funeral or getting together? We had a super nice family Zoom call. We laughed and we cried and we reminisced. The day of his cremation, our immediate family will go to the cemetery where the crematorium is, be physically distanced, but at the very least we can be there at the moment that he'll be cremated. We're having friends and family write letters, draw pictures, create art to be placed in the cardboard casket that will be used for his cremation. You can also decorate the casket beforehand as a ritual. It can be a really cathartic experience to help bring acceptance in lieu of a proper funeral. With my mother's home funeral, everyone came and hung out at our house. They were there to say goodbye. We were able to say goodbye. And we don't have any of that with my dad. Rituals are so important. Human connection is so integral to our humanity. So please make sure you create some sort of ritual, whatever that may be. If you've had someone you love die from COVID-19 and are willing to share your experience, I invite you to write it in the comments section below. The more we share, the more we learn and grow from this experience. Stay safe and stay healthy, everyone. We'll see you next time.